Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment of a disease known as Scleroderma. Now this is an autoimmune disorder in which the body's immune system starts fighting against the body instead of helping it. And the symptoms are seen according to which system or which organ is affected. Now Scleroderma is a disease which affects the connective tissue of the entire body and along with that the skin and subcutaneous tissue. This disease is of two types, which is one is localized, the other is diffuse or which spreads in the entire body. The second type is known as systemic sclerosis. What happens is the connective tissue, which normally has a good elasticity, the elasticity gradually starts going away and it starts becoming hard like a scar tissue. Now this, if it is there only in the skin and subcutaneous tissue, it may appear to be a bit troublesome, or it may have some cosmetic issues. But when the same thing starts affecting the internal organs, that can be quite serious and quite fatal in the long run. So this is quite a serious sort of disease which needs to be treated at the earliest. So systemic sclerosis or scleroderma, which is as I said, is an autoimmune disorder, and the immune process goes on for a long time and may gradually affect the entire body, even the important organs, and may cause fatality in the long run. Modern system of medicine uses steroids and immune suppressants to treat the symptoms or slow the rate of the progression of the disease, but it doesn't cure the disease completely. Now here Ayurvedic herbal treatment is very useful to treat this disease. We give medicines which help to retain the elasticity of the affected organs and to prevent the spread and further progression of the disease. Along with that, we give medicines to improve the elasticity of the skin as well as the connective tissue, and whatever organ is affected, we give treatment, symptomatic treatment for to prevent damage in that particular organ. So in this way, oral medication helps a lot in helping to slow down the progress of the disease and reversing the symptoms. Along with that, in patients where the symptoms are quite serious, we add panchakarma treatment modalities like induced vomiting, induced purgation, bloodletting, etc. These are chosen according to the symptoms or the organs which are present, which are affected, or which are the symptoms are present in that particular patient. So a combination of Ayurvedic oral medication as well as panchakarma can help to make the disease go into complete remission, and gradually we can then taper the medicines so as to prevent a recurrence. Normally around 8 to 10 months treatment is required to completely cure all the symptoms and to stop the disease progression and to gradually bring the patient back to normal. But all in all, this Ayurvedic herbal treatment along combined oral medication combined with panchakarma is very effective in the treatment of this disease. So friends, this is a short description of Ayurvedic herbal treatment in the treatment of scleroderma. Let's meet in the next video. Goodbye.